Thank you. Thanks a lot for this. And I welcome you all, the IIRSM members from across the globe. And good morning, evening, and good evening from wherever you are joining. Due to some technical glitch, my video is also not working, and sorry for that. And today's session would be definitely it would be a very insightful, and you will enjoy the session. And I am pleased to share that IIRSM India branch LinkedIn page has got 1,000 subscriber crossed, and thanks for your support ongoing. And again, we are going to launch various programs in IISM India branch, and keep tuned throughout the LinkedIn page and the monthly mailer systems for the updates. For today's webinar, uh, I'm very much pleased, and thanks to our speaker, like for over a few months, he is very busy in his schedule, and but still he take out the time and to share his knowledge with our India branch, IISM branch. And he is none other than Malcolm Staves. He's chemical engineer, and now he is one of the very senior professional. Everyone knows him. He's TEDx speaker, influencer leader, and he currently work in L'Oreal. So I would not take much more time, and I would like to hand over to him, and further we can listen to him, and definitely we are going to enjoy this session. So over to you, Malcolm, sir, and a great welcome to you.
Thank you, Mohit. Thank you very much. Just before we start, obviously it's a great pleasure to be here with you all. Feel free to put any of your questions that you have in the chat. I'll leave time at the end so that we can discuss any aspects of what you've heard or what I've presented, and even maybe what I haven't presented. But before we start, I just want to say that this is actually my first webinar as a fellow of the International Institute of Risk and Safety Management. So I'm very proud and happy to be amongst some fellow colleagues. And just want to say, reach out. I love connecting, I love networking. So reach out through LinkedIn. So here we go. So we're going to talk today a little bit about our health and safety sort of transformational culture journey within L'Oreal. But as a little bit of an introduction, just to let you know that sort of L'Oreal is a very diverse company. It's a multinational company across many countries. We have activities from manufacturing, distribution, R&I, administrative sites, stores, shops, as well as sales force. But what we have is a single approach across the whole of the group. We believe in it's one mission, which basically is to make sure that health and safety we want to see it as a competitive advantage. It's also the right thing to do, as we all know. But in today's world, we're looking for that difference, and we want people to come to L'Oreal because they feel safe. They feel that we take care of their health and their well-being, and therefore, in today's environment of talent, of talent management, of attracting talent, we think this is important. And as a result, we do everything that we can in order to keep people safe at work and healthy and improve their well-being, but also trying to make an impact on the person as a whole, because we don't see the world as being industry and at home or at leisure. We see people as being whole person, whole life kind of approach. And as a result, we have a single approach for the whole of the group, and within that there is a framework for which there is flexibility, and it's very important that we are all on that same journey. And it's that journey of cultural transformation that we've put in place that I'm going to try and explain to you today. So just as a recap, we're about 86,000 employees at the moment. We're in just over 150 companies, and we have about 35 major global brands, whether brands like Lancôme, Prada, Valentino, Diesel, whether it be brands like Garnier or L'Oréal Paris or Vichy, La Roche-Posay. So we have a lot of global brands. We have approximately 16 to 18%, if I remember right, of the global cosmetics market. So very, very big company, a lot of footprint, a lot of diversity, but a lot of responsibility that comes with that, especially when it comes to keeping people healthy and safe. So this is the obvious one maybe for us all. We actually within L'Oreal, we don't actually say that we want anybody to work safely for L'Oreal, or that they should do well-being because of L'Oreal. We really want them to embark on the reason they individually should want to work safely for L'Oreal is because they want to do things outside of work. They want to play football, they want to walk in the park, they want to hold hands with their loved ones. And as soon as you can make people realize that that is the reason why I need to work safely, that is the reason why I need to take care of my health and my well-being, then we change that conversation within our profession. And as a consequence, people will become ambassadors at work, and they will work safely without, you still need the rules, and that we're going to talk about a little bit further, but it's changing that conversation from what we call a little bit the earlier stages of health and safety, which was all about following the rules, etc. And we all know people don't follow the rules, and not forgetting that this is the why we do health and safety at the end of the day. It's not for the statistics, it's not for any other reason, it's simply because our people deserve to work safely in a healthy environment. And also, why not work on their well-being as well. So what we do within L'Oreal is something we've put in place for many, many years. This is a hybrid of what many of you may know as the DuPont-Bradley curve, which has actually came out, was published, I think, in about 1996 by DuPont. And what we like within L'Oreal is it gives you a roadmap towards interdependence, towards where you want to go, towards that excellence or even beyond that you're searching for. And within that, for those that don't know, there's a part that is reactive mode, a part that is dependent mode, independent, and interdependent. And this basically for L'Oreal is very much driving from health and safety just happens, right? Accidents just happen, we react maybe to accidents or not, but that's the kind of mode we're in. And we're really only bothered about compliance with law, and maybe not even compliance 100% with the legislation. I imagine most of you have challenges sometimes being 100% in compliance with the law. And then you go through to what we call dependent stage, and this is where we see the management getting more and more involved with driving health and safety and well-being. So from being the EHS manager, us, in the reactive mode, now we're seeing that transformation on to, yes, it is my line manager. My line manager is bothered about my safety, and he starts to drive it. And they drive it as they evolve along this culture curve. Then in the independent mode, okay, this is where employees really start to get it. This is the way we see it. This is where they start to get it. They start to get involved. They start to do risk assessments, to get involved with steering committees. They are just starting to be motivated in driving it, but very much in the early stages of that evolution. And then the final section, which is the ultimate objective of developing our culture within L'Oreal, interdependence, where we look at, everybody looks after not only themselves, but their brothers, their sisters, the people around them. And at the same time, we share values, our value of health and safety within the organization. We also maybe extend it beyond, and that's something we're going to discuss a little bit later. And what I'm going to explain to you is how that lives, how that culture curve that we've had in place in L'Oreal since 2010, how it lives and how we use it as a roadmap to transform our culture from being reactive mode, EHS equals the EHS manager, through EHS is my line manager, through EHS is me, I am interested in my own safety, my own for whatever reasons is, through to I'm not only just interested in that, my manager is involved, but also I want to protect everybody around me. And how we have done that and how we have developed a strategy to transform our culture. However, as we're talking about this, what becomes important as well to put over the top of this is this can be applied to an individual. Often within L'Oreal, every year, I see people that don't get it, don't get safety, they're focusing on other things, maybe productivity, maybe costs, whatever, but safety they don't really get. And maybe there are people that you know in the same way, maybe they're in marketing, maybe they're in sales, or maybe there could be a plant manager that comes from an industry that doesn't really historically bother about safety. But something happens to an individual and to an organization that it becomes aware that safety, health, and well-being is important. From an individual point of view, it could be something like all of a sudden, there's an illness in the family, or there's a fatality at work. There's something that gets you in your brain to tell you, yes, health, safety, and well-being is important to me. But it's when that trigger happens. And sometimes for some people, unfortunately, it maybe doesn't happen for a long, long time. After that, once somebody becomes conscious, or an organization becomes conscious that health, safety, and well-being is important, they start to put in place rules, right? Somebody, for example, an individual might start following the rules of driving, speed limits, etc. Whereas before, when they were younger, they didn't really bother, they were carefree, they never got caught. Then maybe they got caught by a radar, they got caught by the police, or maybe they were even worse, they were involved with an accident. But once something happens, like on the conscious side, we start to become more thorough as an individual, but so does the organization as you drive from reactive towards dependent. And then we start to have the vision, the vision of where do we want to go? As an individual or as an organization, where are we taking health, safety, and well-being? How are we going to get there? And that is what we see when an organization is going through this independent mode. And then we have the passion, right? The passion comes through because we're passionate about the environment. We're passionate about health, safety. We're passionate about well-being. And it takes us to another dimension, as you all know. Once we can arrive to have employees that are passionate about health and safety, then we've won. Just like everybody that is around us is passionate normally about something, but how do you trigger, how do you create that passion within them for health and safety that very often is sort of being boring, not very interesting at all? How do you make that transformation? What I'm showing you here is performance. Now, many organizations, and rightfully so, are still driven by performance, right? And we can all understand that. Many organizations said, well, you know, we don't follow lost time, we just follow total incidents, or we're beyond that now, we don't follow anything. However, most of the senior management teams in most organizations that I know, right, see accident with lost time, people away from home, there is a cost to the company. We have to replace that company with maybe temporary workers, or maybe it's work that's not done that has an impact on the company. One of the things that a study that was done by DuPont some years ago now identified that as you go towards an interdependent culture, that you reduce your average lost time rate, the number of accidents with lost time. But most importantly, you get better control of the variation of that. So the culture journey itself, going towards interdependence, actually gives you better control of the variation of your accidents, the number of accidents, and as a result, the number of hopefully near misses, and as a result of all of that, maybe potentially the number of fatalities that you may or may not have within an organization. So it makes sense, even only from a performance point of view, without looking at the individual as a person, it makes sense to drive towards a type of interdependent or an equivalent type of culture. So within L'Oreal, okay, what we have is a very high level document called our Health and Safety Essential that basically describes our strategy, our system, our way of doing things, our method and our tools to everybody within L'Oreal. It's not a manual with directives, etc. It's been reduced and simplified in its message. And the objective of that is so that our senior management, our line managers, our employees understand what we're trying to do and what is the why and the objective behind our actual tools. But within that, we work on something called the 8 pillars. Now there you can see, I'll let you read them. You probably read them all already on the screen. Now I've identified 4 that are vital for me. They're all important, don't get me wrong, but the ones that you really need, for me, you need to have a strategy to put in place. The first one is risk management. I mean, you know, very often organizations get involved with doing behavioral-based safety and more advanced things, you know, bringing in AI, etc. But the risk management, the risk identification, the risk assessment processes, the closing corrective actions is not at the level it should be. Well, why would you go on and do fancy, more advanced things if you haven't got the basics in place and you're not doing them very well? So in L'Oreal, we believe that the risk management pillar is our operating license to go further in a health and safety perspective. We also believe that, honestly, the importance of visible, felt leadership is vital. If my boss only talks to me about productivity, if my boss only talks to me about quality and never about my safety, my well-being, or my health, then there is a message. Then there is a message. And we believe that, you know, it's not just about visible leadership. I added the word felt. The leadership has to be felt by an individual that my boss cares. My manager cares about my safety, okay? The other thing that is important that needs to go along with this is training and expertise. So it's important to have professionals like ourselves, members of associations, institutes that allow us to develop continuous professional development. It's right to be curious. It's right to hone in and continually look to develop our expertise, whether it's in risk assessment, lockout, tag out, working at height, or whatever the subjects are. Training here is training of senior management, line management as well. So within L'Oreal, we have a training program for all senior managers. So if we're talking about manufacturing, it would be plant manager, his management team, and above. And they're taught about leadership, not about safety leadership, but about leadership and how leadership is important so that you can lead through safety. So there's a difference for me between safety leadership and leading and leadership on its own. And so we have a program that helps develop the leadership, but helps them to understand how and why leading through safety is important and how they can do that. Then we also have a training program for all our line managers. So everybody below a management committee level in a site down to supervisor has a training program that has been designed and developed by L'Oreal, delivered by my EHS directors at zone level, the corporate EHS teams, and it's given to every single manager globally. Then finally, to complement that, we also have a training on culture and managing these tools and implementing these tools for our EHS professionals. Now, our strategy is really in 4 main pillars, right? So how do we start to put all this together? So the first one is leadership and capability, and we've mentioned leadership, felt leadership is key. Now, the idea here is we believe that every single employee, no matter where they are in the world or what position they hold in the organization, can be a leader, can be a leader when it comes to health and safety and well-being. You probably have people in your sites that are, I don't know, an operator, for example, that maybe is the captain of the local football team, or he organizes big events within the community. There is leadership in everybody. And the question is, from a health and safety point of view, how do you tap into that and how do you use that? Initially, this program starts with really developing the leadership of the line management, okay? So we're all talking the same kind of language, we're all driving safety, and our leadership is visible and felt, like we said before. But the extension of that, and the way we're trying to go, and we're still not there, is try and bring out that leadership in every single employee when it comes to leading health and safety. And the idea being is that, you know, they can turn around and not only stop machinery or stop something because they think it's unsafe, but in a way that's constructive, talk to other employees and say, well, I saw you doing this, can we have a chat? I'm not too sure whether it's safe or not, right? Maybe we can talk about it a little bit more. The next thing is all about understanding risks. And I come back to it at the end of the day. There's a lot of health and safety professionals out there that have gone off on behavioral-based safety and other things that have become, and I'm going to say been sold to them, when very often the basics of understanding risks is not under control. We have a lot to do. There's things being added to our list of things like maybe mental health, well-being, etc. Yet at the end of the day, we maybe need to step back a little bit and say, well, look, have we identified all those risks whereby we can kill somebody? Whereby we can have that, we can kill somebody in one of our sites, or kill somebody while working for one of our companies, or have an irreversible accident. Because with so much going on today, and you're all doing so much, it's sometimes easy to forget about the basics, the things that need to be in place. I would rather have 100 minor lost time accidents a year than one death. Yet I can see people out there that are focusing on trying to drive the statistics down, and sometimes they forget about the low probability catastrophic events that could happen. And surely we need to make sure that's under control. And one of the things about COVID that's happened is, in COVID, we've found that in our sites that sometimes, and maybe rightfully so, we focused on COVID, protecting our people during the pandemic. Great thing to do. However, some of our methods and tools have been put to one side, or they've slightly been changed because we didn't have the time or the resources. And what's important now is to put all of that back on the rails, make sure that the risk identification, the risk management of those important risks are actually in place. The other thing that we work on is engagement, personal ownership, and I'll describe that a little bit later as well, of how we bit by bit we get people involved, but involved in a way that's meaningful, that adds sense to them, not because we tell them to do it, but because they want to do it, because they know it's not only in their interest, it's in the interest of the company as well, it's in the interest of their family and their loved ones. And then at the end, some people don't like governance programs. We within L'Oréal think it's important to have steering committees in each of our sites, to have audits that come from corporate. I manage, or with my team, the corporate governance, culture and risk audit program. So we audit culture as well as risk. But it's very important to make sure that, yes, we've got rules in place, and yes, we make sure that our sites do what they're supposed to do, rather than saying, yes, I've written the rule, everything's fine, boom, forget about it. And when there's a serious accident, we turn around and say, oh, well, you know, the rule is written. We sent you the directive. No. For me, it's very important to follow through, because everybody's human and everybody deviates. And this is why the governance aspects with respect to health and safety is actually very, very critical. Now, let's go back a little bit and talk, so how do we create this transformation of culture? Obviously, this is not the everything, but this is just to give you a bit of a guidance of how we drive this culture change throughout the organization. It's all about this idea of the right tool at the right time. So depending on where you are in your culture journey as a site will determine what tools you should be putting in place. Old school health and safety for me would say, oh, we have all these great programs, let's put them all in place. And the sites suffocate. Sometimes not because it's not a good tool, it might be because they've got too much to do, or it could be because the culture is not ready for that type of tool. The culture is not advanced enough. So what we believe in L'Oreal is that is an iterative process. This journey here from the beginning to the end takes, in my experience, 10 to 15 years, if you do it well and make sure that it's anchored in the program. The first thing we do within the conscious, the reactive mode, is it's all about risk management. You see our program life, this is basically all about 271 top-down items from L'Oreal Corporate in agreement with all my zones, all our zones, which say, you need to comply with this. No deviation, right? Reason why is because behind this requirement, somewhere in the world, either in a competitor, in another company, there's been a death. Or we believe, based on our risk assessments, we could have a death. Now, it's not a question of when. I mean, how do you put a question of when against somebody's life? It's more of a question, if it could happen in 1,000 years, we put it under control. So this is our program life, very top down, audited, all my sites worldwide, including the admin sites, R&I sites, etc. They report on this top down, no deviation, unless they get a consultant that comes in from an external verification, validation that says this system is equivalent to the corporate requirement. And then at that time, they have to come back to corporate, they ask our permission. If we approve it, we modify our requirement so that the rest of the group can benefit. Standard risk assessments, we've got a suite of risk assessments within L'Oreal. Our most important one is what we call GAP. GAP is GHAP, stands for Global Hazard Assessment Procedure. It is environment, it's health, it's safety, it's well-being. But from a safety perspective, within this process, it's the MANCOM of a country, or the management committee of a country, the management committee of a site, for example, run by the plant manager or the site manager or the most senior manager, and they asked only 3 questions. The first question is, how is somebody going to get killed in my site? And they brainstorm on that. Second question is, how can somebody have an irreversible accident on my site? The third question is, how can somebody have a terminal illness in 10, 15, 20 years in my site? An illness that will put an end to their life. And we have to make sure that's under control. That approach then identifies those activities within our organization that could potentially result in that, and then they are subjected to a detailed risk assessment. We also have something that we call safety validation, which is the equivalent of the CE marking, but it's not CE marking. So we took the concept of CE marking and we globalized it. One of the things we do in L'Oreal for risk control is we globalize on standards. So for example, I have for fire, it's NFPA worldwide, whether you're in China, India, or whether you're in Argentina, or whether you're in the United States, NFPA worldwide is our standard. This is the equivalent of CE marking on risk assessments. No machine can go in place anywhere in L'Oreal unless it's been safety validated by the line manager and the EHS team. And it's basically all about detailed risk assessments of that machine, irrespective of what the supplier says. All of that gives us our core, right? Once you've got all those in place and they're effective, you can then start driving through to line management, driving safety, getting line management out on the shop floor, looking people in the eyes and saying, for the next 15, 20 minutes, your safety, your health, your well-being is the most important thing to me. And that's our measure program. Measure is an acronym for measuring effectively safety using recognition and realignment. And it basically is a line management behavioral based safety program. I don't believe, or we don't believe in L'Oreal or BBS or peer-to-peer. We think the first thing you have to do in any behavioral-based safety program or people-based safety program is to align the line management, get them walking the talk, get them credible out on the shop floor, and then we can go further and work on, work with the employees, the operators, etc. There is a secondary effect of Measure, which is obviously if you go talk to people about their safety, you have an impact on their safety. Then as we go further down the culture SIO, and on the SIO, it's basically safety improvement opportunity, using the eyes of visitors, the shop floor, auditors, anybody that comes to site to identify opportunities for improvement. Very often they're risk-based. The thing that's important here is that if you were an associate or an operator and you came up with a safety improvement opportunity, the only person that can resolve that is your boss, your line manager. Now, it might be an ergonomic problem. He still has to resolve it, but he would go maybe to the EHS team, ask for help, etc., and bring it in. It creates visible felt leadership. It creates employee engagement. It creates collaboration between supervisors, managers, and their teams. It's a very, 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 very strong tool. Then we have visible fundamentals, which is very much based on the old DuPont stop, which basically is the operators working together to identify a list of actions or things they need to check themselves, more of a tick list kind of approach on a daily or a weekly basis to make sure that they stay safe. Now, some sites make the mistake is these visible fundamentals come top down. Well, it's not the way we promote it within L'Oreal. Each department develops its own visible fundamentals, supervisor with his operators. They identify what are the 5, 10, 15 things that they need to do to ensure their safety on a day-to-day basis or weekly basis. They then agree the terms and they create their own visible fundamentals, their own checklist, for want of a term, for themselves, right? They don't necessarily engage in conversation with people because we want to avoid conflict with work colleagues, etc. So it's more of a checklist at a distance. Supervisor checks things to make sure, okay, the trends are pretty good. Wearing the gloves has dropped to 70% when we've been doing these. Maybe I need to have a chat with the team about wearing gloves, as an example. What that does is, the visible fundamentals is, if you look at what's common across your different departments in the visible fundamentals, you could take those items that are common up to a senior level within the site and create your site golden rules. A lot of sites, in my opinion, make the mistake of writing golden rules in a nice office with some senior managers, or maybe just even the health and safety professional, and then it cascades down. For us, that's not the way to do things, because it's imposed, and very often people don't understand the why, etc. But if you create visible fundamentals, you take the ones that are common, created by the people for the people, you then bring them to a high level and you make them your golden rules for the site. It's a much stronger message because the golden rules were created by the operators, the people on the shop floor. Makes a difference. Take Two is a very important program that we have as well. But that's basically last minute risk assessments, but you need to be quite advanced on this. Now, what's important here is, and you're probably asking yourself the question, how do I know where I am in my journey? In L'Oreal, we have created, back in 2010, a culture audit program. The culture audit program gives you a score. Okay, it also gives you a roadmap for improvement. However, more importantly, it puts you on this journey. It tells you where you are you reactive, dependent, independent, where you are, and as a result, what are the tools you should be focusing on in this journey as we drive towards interdependence for all our sites. Constructive challenge is very advanced, but basically it's all about being able to challenge some people in a constructive way, without recrimination, without them being told where to go or being shouted at, because people understand that you're actually having a conversation with them about their safety because you care. but that's quite an advanced culture. And within L'Oreal, we have it in our journey map, but we don't have a lot of sites that are at that kind of level. And then underneath all of this, we have a program called Safe at Work, Safe at Home. What we need to do within our organizations, we found people need to be proud of what they're doing and how they are contributing. And one of the ways we found was to include the aspect of when we do training about work at height, risk assessment, electricity, lockout, tag out, we say, and at home. So we look for that at home aspect. And the idea being is to export our culture and our ways of and our risk approach, etc., into our families, into our local communities, and also within other companies. We do a lot of benchmarking and sharing. Everything that we have within L'Oreal, we share without problem with any other companies, because by sharing, we may just save one life somewhere else, somewhere in the world. And that's our program called Safe at Work, Safe at Home. So we use the word safe, but it is actually health, safety, and well-being. So this signifies a little bit of what we're doing beyond the gates. You can see here various activities. Recently, many of you may know that I was in India for a week launching Keeping Kids Safe, because the number of accidental deaths of children under 11 years old in India is quite high. And along with the senior management, we launched a program, which is a global program called Keeping Kids Safe. So we went into local schools. We brought the kids in of the parents that work in our sites, and we did sketches, we did fun things. But the idea was to try and raise the level of awareness of why safety is important and what the risks are at home relative to, in this case, India. But we've also launched the Keeping Kids Safe program in China and also in Brazil. But India, it was about 4 weeks back now, and we just launched it globally. And because the idea is that the younger generation, these young people, there's a that have accidental that have die accidentally for reasons that could be prevented. And if we can just make one difference in the life of one child, then everything is worth doing. So we launched that recently in India. I was in Mumbai, Pune, and Chandigarh. So where are we today within L'Oreal? And I'm nearly at a conclusion, so hopefully we'll then have questions. So we are creating this at work, at home approach, this sense of pride to actually make a difference. Like, for example, many of our sites teach all their employees, they give them first aid training, including baby training as well. Not because we want them to be first aiders, but because we want them, whenever needed, to save the life of a loved one at home, they're capable of doing it. It's a life gift. We're trying to have a ripple effect on our ecosystem. We're starting to drive well-being, and we're evolving our culture. We've seen that health and safety culture curve. It's not actually an health and safety culture curve. It's a risk searching culture curve, okay? And because that's what we're trying to do. How do I see risk? How do I react to risk? And how can I help others do the same? But we're now evolving, I believe, in L'Oreal in some areas, more and more to a culture of care for others, which is this independent state. Now, I now have a video of one of the ways that we're trying to create pride within L'Oreal is by external recognition. So hopefully this video is going to have sound on it. So this is how we're trying to do this. Change the message and the communication. Okay. So just to conclude, and then we've got time for questions and if there are any out there. So just to conclude, I think as you embarking on a culture transformational journey, it's important to make sure your risk foundations are solid before you really embark on anything. Trying to do things like behavioral-based safety, trying to do other things that are more advanced, bringing it, etc., is maybe not the best way to do it in our experience. You need a strategy for culture transformation. It doesn't happen overnight. It's a long journey, but you need to have the strategy in place. I've been lucky. I've had this position in L'Oreal now for 15 years, so I've been able to keep the focus on that journey. I know, you know, like with new plant managers or new people that come in, when a senior people change, sometimes the strategy changes as well, but we've been lucky in L'Oreal. We've talked about felt leadership, visible leadership, and employee engagement. They are fundamental, and all our programs are designed as mini systems, and we asked ourselves the question for every single one of our programs: what is the role of the leadership? What is the role of the employee? What is the role of EHS, and what is the KPI to measure the criteria for success? And every single one of our fundamental programs have that kind of mini system around them. The right tool at the right time, we've already mentioned that, depending on where you are on the culture journey, but I would also add in the right hands. When is it time to hand over from EHS equals EHS to EHS is my line manager with support from the EHS profession, from us, and when is it time to hand over to the employees? You need to focus on your leading indicators. I think leading indicators drive these internal mini systems, very, very important, including an indicator on training. That's we found that has been vital for us in L'Oreal. And the final thing is that I would say is network. Mohit introduced me and I was very flattered. But at the end of the day, I am nothing without my network. When I have a problem, I don't have the answers. I reach out to my network, whether it's companies like Nestle, GSK, Unilever, P&G, competitors, but we network together. Why? Because simply we don't know everything individually, each one of us, but together we are stronger, and sharing is caring. And so I would say to you, you know, going forward, if you're early on your journey here or you don't do it already, networking is pretty big. So Mohit, thank you very much.
Yeah. Thanks a lot, sir. And it was really a wonderful insight. And I hope all the members from across the globe would have enjoyed it. And yes, we have a few questions. And if you say, then I can start with the questions. So we can cover the questions part.
Yep, anything you want.
Yeah, sure. So the first question is from Mr. Madhukar Tiwari from India. The session we had was excellent.
Thank you.
Just I wanted to know what you know how ESG factors be implemented into a project system and contribute to the growth of a company
Could
related
you
to
repeat
ESG.
the health and safety?
ESG is mentioned. How ESG, environmental, social, governments.
ESG, yeah. So ESG, I wouldn't say has been really integrated. ESG is environment, social, and governance. It's very much at a high-level corporate thing. If you talk to people at site level, very often ESG isn't really on their radar because they're at the cold face, etc. ESG sustainability is a fundamental part of L'Oreal. It's part of our DNA. We're very strong on environment. We're very strong on most of the social aspects. We've always got room for improvement. Unfortunately, within the ESG agenda, health and safety is not really given the visibility that it should be. Very often they just ask us about number of fatalities, number of lost time accidents, number of illnesses, absenteeism from illnesses, etc. So we've integrated it within L'Oreal, but you'd expect that from a big multinational company like us. But we like to think that within L'Oreal we go beyond. I'm quite active in trying to develop the importance of health and safety within the S of ESG. I'm at a conference, a couple of conferences in May where I'm promoting this. But honestly, so I'd say L'Oreal, I think we're okay. We have opportunities for improvements, especially on the S side, but I think we're in good stead.
Okay, okay. So the next question is like we heard about health and safety. What about the environmental part? How L'Oreal policies and practices are around the globe in regards to conversation of waste management?
Wow, good question. I actually have an equivalent that looks after environment. Environment is so important for us that it has an individual corporate management team. So I have corporate health, safety, and well-being. I have an equivalent that has the environment. So, but we have very aggressive targets. We've started those in about 2010 on primarily, like many companies, targeting on CO2 emissions, waste minimization, and also water minimization. We initially set 50% reduction in 50% reduction targets for 2015 on a program at the time that was called Sharing Beauty with All. That has then evolved to a program called L'Oreal for the Future, whereby now we're going into scope 2 and scope 3, reducing travel, transportation, carbon neutrality of all our sites worldwide, no matter where they are in the world, including admin sites, including stores. We're driving water loop factories, especially to try and minimize the water that we use. And we're even to the extent looking at, whereby we're looking at the future maybe facilities, we're looking not to go into water stress zones as an example. We have a zero waste to landfill policy, which is respected in all our sites worldwide. I think there's a couple of sites whereby the legislation, local legislation, requires landfill, and you can't really export to another country. But yeah, we're very aggressive on this. And if you look up L'Oreal for the Future, which is and L'Oreal, you'll see we're putting a lot of stuff behind it, reducing plastics in our containers, trying to reduce the amount of water we use, etc. We're using biodegradable raw materials. It's the whole thing. I would say this aspect of L'Oreal is really part of our DNA as well. And it also is our license to operate, because if you don't do all this kind of good stuff on the environment, then I don't think companies are going to be around in the next 5 to 10 years. It's an expectation. It's a license to operate. There you are.
Yes, rightly said, sir. Yeah. So coming towards the next question, like as I understood with the presentation that all the best practices of L'Oreal are in place, but I would like to know what are the disciplinary actions are taking place in L'Oreal if something there is encountered repeated violations from the same person, and how L'Oreal safety team handle them. It's one of the
Well,
questions from the audience. Yeah.
that's a really, really good question. Typically, if we're talking about real violations of safety rules, okay, there's a difference between being human and making a mistake, but repeated violations. The first thing to do is to look at why the violation was done. I mean, there are situations whereby maybe you've put in place some rules, ways of operating that are just not possible, if you see what I mean. Maybe it's a management problem, a design problem, or something. So I think it's important to dig deep before we revert to discipline. I really, really do. However, if the rules were normally followed and somebody didn't follow the rules, and as a consequence, there was an accident, I think you have to start the disciplinary process, and depending on the severity of that violation. So we're talking about blatantly not following a rule, not just being human and forgetting or making a mistake, blatantly not following a rule that results in an accident. I think it needs to go through the process, and depending on where it is, I'm still a believer that sometimes you need to look at who is really responsible? It could be a manager. It could be the plant manager ultimately that is responsible. I think those people that look at blaming, trying to blame people are wrong. We should not blame people at all. We should look to understand. And if at the end of the day, somebody knew the rules, they didn't follow the rules, then yeah, that takes disciplinary. If on the other hand, they didn't follow the rules, but the supervisor permanently turned a blind eye or even encouraged them not to follow the rules, then that's a different approach. So I think we need to be cautious here, but I still think that you cannot have people in your sites that blatantly do not respect rules when the rules are good rules. But I know that could be a controversial discussion for another time. But you know, you cannot accept people, especially if you got life. If somebody could die as a result of somebody violating a rule, can you accept that? Can you accept that? Okay, Mohit.
Yeah, so very well rightly said. This discussion, like it can go long, and but the aspect is very right, sir. And
It
coming
is.
to next question, the culture is now of digital. I like to know if L'Oreal is working on IoT, like working towards something IoT related, and how it is helping with safety in L'Oreal industry, manufacturing industry.
Okay, the industry itself is IoT, automation, and all the rest of it. And the way I look at it, my team, we have 650 people that work in EHS within L'Oreal globally, but my global team is just 7, including myself. We need to adapt to accompany the evolution of our organizations. We need to adapt for the arrival of IoT, artificial intelligence, etc. And we need to do that to make sure that we still keep people safe, healthy, and also protect their well-being, because sometimes some of these things that are coming in make people more sedentary, so then they're not moving as much. When it comes to health and safety tools, I'm a little bit more, I'm not going to say reticent, but I'm a little bit more cautious. Our approach, I'm not going to do this kind of thing, digitalization, Internet of Things, and all the rest of it, just because it's the modern thing, in thing to do. If it gives me a benefit, then we look at it. So, for example, our criteria for deciding on digitalization, next generation tools, IoT, is basically set, if it saves time for a health and safety professional or a line manager, then we'll put it in. So we have a group, we have a steering committee, global steering committee with people from the EHS network purely looking at these kind of things. They decided where value added is. We have 6 tools that we are digitalizing, etc., remotely. However, people then ask me, well, shall we digitalize accident investigation? It's really important. We can buy stuff off the shelf. Or shall we involve artificial intelligence to look at all our root causes worldwide and come out with these great trends? The problem is, if you put rubbish into a system, you get rubbish out. So in L'Oreal, what we're doing at the moment is we're raising the quality of our incident and accident investigation, our root cause analysis, because if we're going to go and use software, etc., to identify trends, we want to make sure that the input is the best it can be. Whereas I'm not too sure that's the case at the moment. So that's my position on that. So I'm a great believer in accompanying the business for these kind of industrial revolution, the 4.0. But when it comes to the health and safety, sometimes health and safety is all about being out on the shop floor. It's not about filling in a form or whatever on an iPhone or an iPad. So I think safety is all about being face to face and connecting with people as well. So there you are. That
Yeah,
could be
thank
a
you.
bit controversial for another discussion some other time, maybe.
Yes, yes. I would like to arrange another session then few of the questions. So, considering the time, sir, I would take the last question. I have other few questions which I can mail you, and then further it can be circulated to the
Yep.
audience.
Send
So
me the
here's
other
the
ones and I'll answer them and send them back to you.
sure. So the last question is something during the selection process, what do you look on the resume of safety person what is the best way to get an opportunity with L'Oreal, HSE in particular? So this
Well,
is something out of the track, but if you like to answer.
yep, we're always looking for talent in L'Oreal. So within health and safety or EHS going forward, we're looking for leaders. We're looking for people that can lead, that can coach, that have empathy, good active listeners. We need. I'm convinced that our profession is one of the best leadership professions there is in the world. I mean, we talk to CEOs, we talk to line managers, we talk to operators, contractors, etc. We change our leadership style all the time. So I'm convinced we're looking for leaders that will allow L'Oreal to become future fit in a world of more collaboration, more interconnectivity, etc. So that is important. So we're looking for those power skills of individuals. It's not just good enough anymore to be a good risk assessment person. However, on the other side, I'm looking for people that can do good at doing process safety, fundamental of process safety, looking for people that understand ergonomics. Ergonomics is vital, I think, for the future of work, and we need to have more and more ergonomic people within our teams. And I'm also looking for people that are good at analytics or doing risk assessments, but can work internationally. I have people in my team at the moment. I have a guy from Cairo, an Egyptian. I have a guy from Brazil. I'm English, a couple of French people as well. But we work all over the place, and you need to adapt to local culture. So that's what I need in people as well. So I'm looking for superstars and superheroes that I know, to be honest with you, we all are in our profession. It's a very noble profession of great leaders.
Yeah. Yes, sir. Rightly said.
Easy. Anybody could apply. But
Yes.
tell everybody out there, just connect with me on LinkedIn. I love to connect. I love to share. I love to learn.
Great, great. That's a wonderful reply for this question. It best fit the question, I guess. And yeah, we have again couple of questions, but the time is over, and I know you are very much busy and you have taken out for the sessions. And
well, if you want to stay on for 5 more minutes, I've got 5 more minutes, and then it's recorded, and then you can share that with everybody. It's your choice, even if it's just you and me. If everybody's left and you just want to record the questions, that's fine by me too.
So no issues. Like I can take one more question with
Go
everyone live if you are there. Yeah. So you talked. The another question is you talked about network at the end of your presentations. So
Yes.
what are the different ways people like he said? What are the different ways to build the internal network or external network across the globe?
Yep. External network, just to say my experience, I came across a few people at some conferences many years ago, and working in similar companies with similar challenges. So I suggested, why don't we get together? We started small, 2-3 people, then it grew. Sometimes it's for taking that first step with another company to say, look, let's share. We both have forklift trucks, for example, or we both do risk assessments. Let's share what we do. And it grew like that. I think it's take the first step. I think that's what I would say. And I think go to a few conferences. These virtual ones, like the webinars, are fine, but there's nothing like a physical one whereby you can actually meet somebody, have a drink with them, have a laugh with them, have a joke with them, and create that bond. So that's what I would recommend for the external part. Plus, maybe be a member of organizations like IIRSM. If you're in the United States, the ASSP or National Safety Council, and take advantage of those kind of sessions that these organizations do to try and meet people. I've met quite a few contacts on LinkedIn. I have now and again chats with people on LinkedIn that I've met through LinkedIn. Internally, it depends where you are in the organization. For me, at my level, to put together and ask for my EHS directors to have a network meeting with them and promote network, cascade information through them, it's easy, because I say, we're going to have a meeting, and they come to the meeting. If you're talking about your peers, I would reach out initially to maybe a similar type of site to you within your company and start, you know, connecting with that person. If you're at a regional level, I would do the same with somebody at your level in another region, for example, just so that you can start sharing on best practices. It's easy enough to do. Sometimes the difficulty is taking the first step, and maybe even in today's world, finding the time to do it. But it's worth it. Honestly, if people would say that, look at me and think I've been successful, and maybe you would say I am. I'm global vice president of one of the largest companies in the world. A lot of success in health and safety, but my success is because of my networks.
Right.
Yeah, Mohit.
Yeah. Thank you, sir, for this answer again. And the next questions are how, again, the repeated question, like how can I apply in L'Oreal? Definitely by website. So, and
there is a website. It'll be we have several websites for each country, but each one has an access for careers, whereby what happens, you actually put your CV, what you're interested in, it shows all the jobs that are available within the organization. And what it means is very often you put your CV in there and it stays in that database that HR can look at, if you know what I mean. So HR will say, oh, we're looking for a health and safety professional in, I don't know, in Chandigarh, and they'll look through and try and identify somebody from that. That's the first port of call. The other port of call that we use obviously now is LinkedIn and social media as well. And you know, I'm not averse to no promises, but you know, if you're internationally mobile, and I don't have a problem with you reaching out to me on LinkedIn, sending me your CV. No promises, but I can put it in the system. But and you never know.
yeah, absolutely, sir. Yes, and the another question is your LinkedIn ID. So I can forward them, or else you can, if you want. Someone
No,
has
I
yeah.
don't have it, but I think if they put in Malcolm Staves, I think I would come up pretty quickly. I think I'm the only Malcolm Staves in the world sometimes.
Yeah, the unique one. Yes.
Yeah.
So as of now, that's it only, sir. And the other question was of process safety, and which somehow you answered it.
Well, and
And,
just to let you know, I mean, process safety is at the heart of everything that I was taught at university, and I have a process safety specialist in my team.
okay, great. Sir. Yeah, as you are a chemical engineer by background, so process safety would be definitely, it's a great point.
Yeah, definitely. Thank you.
Yeah. So that's it, sir, for today's question answer session, and definitely it was a very interesting webinar, and the question answers, the question were also like diverse kind of. So I enjoyed it, and I hope all the audience would have enjoyed across the globe. And thank you again for sparing your time. And definitely I'll reach you after a few months for some other webinars on different topic if you'd like to.
Not a problem at all.
Yes.
It'd be my pleasure. And thank you very much for the opportunity. And just want to say to everybody, stay safe. Take care.
Yeah. Yeah.
Thank you very much.
Sir. Thanks a lot.
Thank you, Malcolm. Thanks, Mohit.
Thank you, Lauren. Thank you.